Heart attacks can get you there. As with many severe heart attack victims, I had a glimpse of misery follow my glimpse of glory. During the treadmill exercise performed several days later, my blood pressure went soaring and the EKG sagged in the wrong places. This meant poor coronary blood flow in still another vessel, and to determine if additional heart attacks were pending, the coronary angiogram would be needed. Under local anesthesia, I watched the TV screen while my partner Charlie inserted a hollow catheter into the groin artery and advanced the tube through the fluoroscopic guidance back up the blood vessels into the heart. Contrast solution was then injected into the mouth of each coronary vessel, supplying the heart, and the X-ray video pictures were made. Looking at the overhead screen from my recumbent position, I could see the damaged part of the heart that was not contracting. If the chest were surgically opened at that moment, I picture in my mind that my heart would probably look like the heart of an autopsy victim that I had seen a long time ago in one of our local hospitals. That autopsy was conducted by the foulest doctor I think I've ever known. "What's the matter, boy? You going to throw up?" the forever burping pathologist said, poking his finger through the mushy black-blue substance of the heart attack. As he turned the heart around in his hand, the bruised area became readily visible, but he plunged the coronary artery causing the attack was hidden. Let me read that again. But the plugged coronary artery causing the attack was hidden under a thick layer of fat. "Looks like somebody hit it with a hammer," he quipped as he dissected layers of fat obscuring the rock-hard arteries. Finally, somewhat adjusted to his grossness, I asked, "How often do you find this much fat?" Using the dull end of the scalpel, he scratched his head. "I haven't seen a heart attack yet that didn't have a lot of fat." Grabbing a handful of fat, he lifted the heart to eye level. "Never used to see so much, but nowadays everybody's got it. A determined fat America is gorging itself into a society of fat people. People are as fat on the inside as they are on the outside." I noticed that he said this, his own belly draped like a big apron over the autopsy table. Even his tiny eyes were almost obscured by his fat cheeks. Then he seemed to come up with a good idea. "Open yourself a clinic for fat people, boy. You'll laugh yourself all the way to the bank. Mark my words, treating fat people will be the big thing of the future." While giving this advice, he deftly and unemotionally divided the victim's skull with a buzzsaw, and I queried, "What do you think will causes people to have so much fat?" "Dunlop's disease," he laughed, displaying bad teeth. I should have known better than to ask, but I nibbled. "What's that?" I asked. "Dunlop's disease. That's when your belly Dunlopped over your thighs." I smiled grimly at my mistake. I had taken the bait, hook, line, and sinker. I should have told that obese rude pathologist to look at his own abdomen, but the tube in my groin dragged me painfully back to the present. I knew that it would be maybe 6 to 8 weeks before the soft area of the heart would heal into a firm scar tissue, at least for minor activities. I was determined to be a patient and not an impatient patient, as Raymond Royce had been a week before. Raymond had stayed home from work for 3 days with indigestion, quote unquote. Feeling better, he returned to work on the 4th day. Loading some boxes with another employee, Raymond suddenly grasped his chest, turned blue, and dropped to the ground. A few gasps later, he was dead. Raymond's autopsy revealed a large soft bulge remaining from the heart attack that occurred a few days earlier. He returned prematurely to work, and the soft bulge had ruptured like a weak place in an inner tube, suddenly and unceremoniously dumping his life's blood into his chest cavity. It's not unusual for people to die a few days after what they think is heartburn, giving them more than an adequate glimpse into the hereafter. In my own case, the procedure showed the right artery, coronary artery, had completely closed and the other vessels were okay. There was no need for bypass surgery, balloon angioplasty, or atherectomy. or laser treatment. Of course, that was back in 1980, when most of these treatment options were not available. What was available and still remains as a first-line treatment was clot-dissolving drugs to reverse early heart attacks before permanent clot closure occurs. Vic Bond, my instrument flight instructor, was one who benefited from these drugs. Apparently a man in good health, he nearly died quite suddenly. Initial IV streptos... I can't say it. That's too medical for me. The first available clot-dissolving drug. It's some drug dissolves clots. How about that? Resolved both pain and sweating quite early. The procedure quite new to medicine. Every half hour he received strep until the blood pressure, pain, and EKG changes had recovered. Then IV heparin was added to prevent reoccurrence of clots until the angiogram procedure was done, which showed multiple vessels involved, and bypass surgery was done. No glimpse into glory occurred in Vic's case. You say this could never happen to you. You say you're not at risk because you jog, swim, play tennis, and work out in a health club. That you are immune because you eat only healthy foods and have good cholesterol levels. These are ideal things, but every day we bury heart attack victims with normal cholesterol levels who appear healthy. Several had their health club membership cards in their wallets. Unfortunately, in 25% of heart attacks, there is no warning at all. They just drop dead. This is the essential reason why every household should be acquainted with the medical gospel of CPR. Immediate CPR can keep half the sudden deaths alive until qualified help arrives. Simple training is available through the Heart Association or the Red Cross. Who is most likely to develop coronary disease? Those people predisposed by high blood pressure, diabetes, high cholesterol, smoking habits, obesity, inactivity, and those with clear family history of the disease. If you are one of the predisposed, when will a possible heart attack likely happen? Strangely, the event is more likely to occur during sleep, when the blood flow is sluggish, the blood pressure is low, and the heart rate is low. It is then that clots form and attach to the rough walls of hardened arteries. Predisposed people are more afraid of going to sleep than going to work, since activity induces only 15% of coronary events. 85% actually occur while doing nothing, like sleeping or watching TV. Because of dietary tradition, the United States continues to be the second leading nation in the world in the frequency of hardened arteries and heart attacks. Americans like fat because a high-fat diet tastes good. The tradition of lard biscuits, so to speak, may be the problem. I make lard biscuits because my mother made lard biscuits, is the usual answer. Poor countries unable to afford fat diets may die of starvation, but not of heart attacks, perhaps because people cannot make lard biscuits.